I started going blind in October, November. My daughter said that I would have to go to the hospital. So I went upstairs to get myself ready. And as I came downstairs, of course, I was completely blind then. I wasn't used to not having my sight. I forgot about counting the stairs or thinking about the stairs, as the stairs are in 3 stages, and I thought that I'd reached the bottom layer, or the bottom steps. In fact, I was only halfway down and let go of the rail, and I fell the remaining stairs.
John Fraser lives in a village near Thirsk in North Yorkshire. He suffered a fall in his own home. Every year, a significant number of people over the age of 75 are treated in accident and emergency as a result of a fall. But what if there was a system to support those most at risk of falling, to reduce the chance of them falling in future?
Oh, hello.
Hello, Mr. Fraser.
How are you?
I'm fine, thank you. How are you?
Not too bad, thank you very much.
North Yorkshire and York Primary Care Trust now has such a system in place. Patients deemed to be at risk of future falls are assessed to see what support they need. The assessment looks at their home environment to see if there are any obvious risks that could increase the chance of a fall in the future. Further checks are then carried out to make sure the new support has been put in place.
Because your original fall was on the stairs, we spent a bit of time looking at the stairs and identified that you just had the one banister on the stairs.
Right.
So we suggested that we put another railing on the wall to make it safer, so that you could come down the stairs holding on to 2 rails, and we see that that's now in place.
Oh, it's given me a lot of confidence.
Good.
Medical checks are also carried out with the patient.
Just like to check your blood pressures, that's all right.
By all means.
We'll pop it on this arm, it's all
The
right.
scheme initially ran as a pilot, but has proved so successful that it's being introduced across the whole of North Yorkshire. And the scheme is working. Figures from the pilot have shown a reduction in hospital admissions of around 8%.
In each of the district nursing teams we have a falls prevention coordinator. This coordinator receives the referrals from other agencies such as GPs, A&E departments, social services, the ambulance service, practice nurses, district nurses. Patients can refer themselves, or they can be referred by the family. The falls prevention coordinator then contacts the patient to organise a time that's convenient to the patient for the falls prevention coordinator to visit the patient in their own home. There's 3 assessments that are carried out at various intervals. The initial assessment is carried out, then a 3-month assessment, and then a 12-monthly assessment.
The scheme runs alongside other support work in the community delivered by a range of organisations, including the Primary Care Trust. This includes exercise classes for older people to improve their confidence and mobility. Age Concern runs such classes in Thirsk.
As we do get older, sadly our eyesight might be getting worse, we may be on numbers of medication, our balance might not be as good because we may suffer from certain conditions like Parkinson's disease. So it all means that potentially we could be more at risk of having a fall. But equally it's about raising awareness with older people themselves, how they can take measures to prevent some of those falls happening, as well as all the different agencies working together to ensure that help and support is there if that fall does happen.
John Fraser is confident that, with the extra support in place, there's less chance of him suffering a fall in future.
The support that I have received from the social services, not only in the way of carers, who have been wonderful, all of them, I can't speak too highly, but also the nurses that have come here, as I'm able to get to the surgery, and so that, as I say, I get utmost support from everybody.